Today, I'm delighted to be speaking with Preetee Hylton, dental nurse and safeguarding lead at the No. 8 partnership in London, in the next of our series of speaker interviews in the lead up to Dentistry Show London, which is taking place at the London Excel on the 6th and 7th of October. At this year's Dentistry Show London, Preetee will be speaking about the oral manifestations of sexually transmitted diseases in the Dental Care Professionals Hub on Friday, the 6th of October at 10 o'clock. So thank you very much for joining me today, Preetee.
Good morning. Thank you very much for having me.
No problem, it's my pleasure. So the oral manifestations of STDs is not something that's spoken about an awful lot in dentistry. So I just wanted to start by asking you what made you want to explore this topic?
So it started in February, actually, when I was asked to write an article for Valentine's Month for the Dental Nursing Journal. So my first thought was STDs. Like, why do dental professionals not talk about STDs? So I'm talking about dental nurses, dental hygienists, and dental therapists, dentists. It's still quite taboo, isn't it? Like many subjects in dentistry. And I think I am known for speaking about quite challenging topics. But yes, this is something just because we don't speak of enough in dentistry. And writing an article is one thing. You know, I did get a lot of engagement from my colleagues at work, but how should I put this? Perhaps, to actually discuss the topic with the audience at the dental show would raise better awareness about it. So that's why we'll explore this at the dental show very soon.
Great. And which STDs can dental professionals actually detect in the mouth, and what are the most common signs to look out for?
So as we probably are aware of, STDs are very contagious. So you get things like chlamydia or pubic lice or hepatitis, which are very contagious, but they don't manifest orally as much. But you've got oral herpes, which is your cold sores caused by a virus. You've got your human papillomavirus as well, which, according to cancer research, has been the cause of 25% of oral and oropharyngeal cancer, actually. Then we've got bacterial ones, which is gonorrhea and syphilis. And you tend to get, in dentistry, of course, we work in the mouth, so we do carry out soft tissue exams, and if you notice anything like blisters or ulcers or rashes around the mouth, so we're talking internally and externally, you also get unusual discharges. So if it's an STD or an STI, it's going to be probably green, yellow discharges, and it could be quite smelly as well. I know it's not very pleasant to speak about, but we're dental professionals, so we see this. I don't see it very often, but I have noticed a few in the past. Sometimes you get skin growths and warts around the mouth, and when we're talking about HPV as well, which again is a cause of cancer, so it's very important that we look out for sort of red, whitish patches which are not healing after 3 weeks, and that's when you start referring patients urgently to your local cancer service. So these are the common signs you look for. Obviously, when we speak about it at the dental show, we'll get more into it. But yeah, these are the common signs.
No, absolutely, that's really interesting. And why do you think it's so important for dental nurses and dental care professionals in particular to be familiar with the signs of STDs in the mouth?
Because, when it comes to cross-infection control, we do apply the universal standards, but it's just good to know what we're dealing with. Also, it could be a safeguarding issue, because it might be an indication of sexual assault as well. That's why we need to be comfortable to speak to our patients, to ask them questions. If you notice anything unusual in the mouth, like ask them, have you noticed this? How did this happen? Are you aware of it? And just get the conversation going so that they feel safe in the dental practice. And it should be a safe space as well. But we give smoking and alcohol cessation advice. So why not sexual advice as well? Because if we are getting oral manifestations of STDs, you know, this should be something that we should discuss openly with patients as well, especially when it comes to young people who are vulnerable adults. And you've got I was discussing with my clinician, and he actually said to me, this is common mainly in over 60s currently. So this is something we will explore as well. But yeah, I think that's why it's important that we are familiar with STDs and the signs and the symptoms, and we should be able to listen to our patients, to what they've got to tell us, so that we can actually help them.
Yeah, definitely. And what advice can dental professionals give to help patients protect themselves from contracting STDs?
So the use of condoms. If someone is sexually active, and again, these questions should go on the medical history form. So using condoms for vaginal and anal sex. If patients are engaging in oral sex, they can make use of a dam. So it's like a sheet, but very similar to a dental dam. Sex toys, if they're using sex toys, to wash them properly, disinfect them, and cover them with a condom, especially if they're being used on other sexual partners as well. If I don't know if disposable one exists, but if they do, it would be a good idea to invest in those. Not to engage in sexual activity if they know they've tested positive for an STD. And I always advise my friends, if they are dating, to have their future partners tested first before engaging in sexual activity, because we're all grown ups, you know, we need to talk about it. You know, if you're going to, you're going to be sexually active with this person or people, just to keep yourself safe, like have yourself tested and have the other person tested as well. So yeah, that's basically the advice I would give.
Thank you. And you touched on this a bit earlier, but would you say that there is still some stigma around talking about STDs? And if so, how do you think we can overcome this?
Open and honest conversations, and on a very regular basis, and to actually maybe this is going a bit too far, but to include this in the curriculum for maybe dental nursing courses, or in or your dental hygiene and therapy courses at uni, even in dentistry, basically, to actually just talk about it very openly. And we're professionals, we shouldn't be judging anyone because we're there to help. But yes, active, honest and open conversations would be the way to do this.
Amazing. And are there any current resources in particular that you would recommend to dental professionals and patients to learn more about STDs?
So the NHS website has got lots of information, but if we're focusing on HPV, Cancer Research UK and the Mouth Cancer Foundation have got lots of resources, lots of leaflets as well that you can download and probably share them with patients and colleagues. It's a good idea to get tested as well if you notice you've engaged in sexual activity, and you health clinic, and they'll be able to help you out. So if you go on Google and you type your sexual health clinic and where you live, you should be able to find one nearby, and they've got loads of resources as well.
Amazing. Thank you for sharing that. And then my final question for you is, apart from your own speaking session at the show, what else are you looking forward to about attending Dentistry Show London?
Ooh, I love attending dentistry shows. Do you know what? Speaking, I used to attend dental shows because we get loads of freebies, don't we? We get toothpaste, toothbrushes. But I love going there because I get to meet my friends. Networking is absolutely amazing. You've got, and yes, to meet my colleagues, to network. Also, I am responsible as a dental nurse for ordering materials for my clinician at work. So, to go to the suppliers to have a chat about them, or if I've found anything interesting, I know they say that it's the dentist who makes the decision. But if I've found something that I think my clinician would be interested in, I'll go and have a chat and probably, get a sample, get into the practice, try it out. So it's really interesting. But yes, mainly to meet colleagues, but we also get loads of CPD, don't we? Which is, I need to go explore the website. So once we've completed the interview, I'll go and see what topics we're talking about, because it's just nice to see your colleagues speaking as well. But yeah,
absolutely.
Will you be there?
Of course, yeah, definitely.
Yes, so I'll get to meet you as well, which is great.
Amazing. Yeah, definitely. Looking forward to it. Well, Preetee, thank you so much for joining me today. It's been so lovely speaking to you, and I will see you at the Dentistry Show London in October.